analysis from our panelists, Director of Public Health, Catherine Wells, Local Public Health Authority, Dr. Ron Cook, and stepping in for Mayor Dan Pope today is Councilman Steve Massengill. So let's get started with Catherine Wells.
Good morning, everyone, and thank you for being here today. I'm going to quickly update you on where our COVID-19 case counts are, and then also talk a little bit about some of the improvements we're making to our data system. The health department is currently reporting 9,936 cases. We're going to hit that 10,000 case milestone probably this evening. The number of cases that we're reporting each day is still high, and we continue to see a record number of cases being reported. We've also seen multiple deaths reported this week, with now 113 Lubbock County residents who have died of complications to this disease. Our condolences go out to those families, friends who have lost a loved one. Over the last few weeks, the health department's actually been preparing to move to a new data system. The move should be transparent to the community, and it will not change the data that is being presented on the dashboard. However, it is going to make the system that is feeding into that dashboard much more robust. The big reason for this change is the health department normally processes between 200 and 300 disease reports a week. Now with COVID, our department staff is processing over 2,000 records a week, and our prior data system could not handle this volume. We have over, we now have over 10,000 records, positive records within our system, and we really need to find a better way to handle that data. We'll start reporting out of this new system, hopefully this evening or at the latest tomorrow. You shouldn't see a big change. However, there might be a couple little changes with some of the race ethnicity categories or the number of cases reported each day. Some of those might change days, but we shouldn't see a big change overall to our total case count. Again, I'm really happy with our school districts and the way we haven't seen COVID transmitted within the school systems, and I hope everybody can continue that excellent work. At this time, I'll go ahead and pass it over to Dr. Cook.
Thank you, Catherine. As Catherine reported, our schools are doing pretty well. And so a couple of things I want to bring up today is the number of flu cases that are increasing in our community. We're starting to see few cases of flu. So if you haven't received your flu vaccine from the pharmacy, your provider, your physician's office, please go in and get that done, because COVID and flu together present primarily with upper respiratory infection symptoms. That's how it typically presents. It's a runny nose or a cough or fever. And so if you have your flu shot, more than likely, it'll be easier for us to decide whether or not you have COVID or flu. And so please go get your flu shot. That's number one. So as school started, we worry about children getting COVID. Children are going to do, for the most part, very well, much better than somebody, say, my age. But they're going to present like flu. So get their flu shots too. So they may present with a runny nose, a cough, or a fever. Typically, COVID fevers are a little higher than flu and last longer than flu fever. So a fever, we define a fever as 100.4. So a temperature of 100.4. That's what the medical community defines a fever. And in infants, it's 99.5. If you think your child has these symptoms, then please call your provider, your physician's office, and have them evaluated to see whether or not they need to be tested. If your child has severe symptoms, and we see a few little differences in children with symptoms, severe symptoms, and they typically have more GI symptoms, a gastrointestinal symptoms, I'm sorry. And then also they may have a rash that may throw them off a little bit. And so please check with your provider. If they have a rash, if they have behavioral changes, if they have lethargy, if they have slurred speech, if they have seizures, difficulty breathing, chest pain, those sorts of things, please call your provider or take them to the emergency room so they can be evaluated. Some of those things I just listed, like chest pain or slurred speech or seizures, those are significant worrisome signs. So let's get those individuals seen. The last thing that I want to talk about are mental health issues. There is plenty of literature now that says because of COVID, not only because we were cooped up, but because of the infection on the brain, we call it encephalitis, that behavior changes have occurred and mental health issues have risen to the top. We see that anxiety disorders are 3 times above baseline. We see that depression disorders are 4 times above baseline. Suicidal thoughts are increased, and then also substance abuse has increased during this many months of COVID now. I want to encourage you to reach out to your loved ones and to your friends and just say, how are you doing? Is everything going okay? And if, it's okay to even ask, are you having depressed thoughts? Are you blue? How are you sleeping at night? And some may ask about suicidal thoughts. Please don't worry that you're going to push somebody over the edge just because you ask about suicide. It is much better to ask if they're depressed or having suicidal thoughts or what we call ideations, or are they depressed? It's much better to ask somebody than for them to go ahead and act on those and we lose that loved one or our friend. So reach out to your friends, reach out to your loved ones, and just ask how they're doing. That's all that it takes. I'm going to list a couple of hotlines on our city's health department website. And that number is for Star Care Crisis, and that's 1-800-740-1414. And then Star Care COVID Mental Health Line, that number is answered from 9 a.m. to 6 p.m. The first one was answered 24 hours a day. So the Star Care COVID Mental Health Line is 806-740-1450. So all those 3 things to say today is get your flu shot, reach out to your loved ones or your friends and just check on them. How's their mental health doing? Wash your hands, socially distance, and wear your facial coverings. That's all that I have today. Let me hand this over to Councilman Massengill.
Thank you, Dr. Cook. Good morning, everybody. I'm standing in for the mayor today as he has a conflict at this time. First, let me begin by expressing our sympathy on behalf of the mayor and the city council to anyone who's lost a loved one and any businesses that have been affected by COVID-19. I had a friend call and share with me that he lost a parent to COVID, and it's just a reminder about how serious this is and that we should take precautions to protect ourselves and those around us. So I'm going to start by going over the data. So I'm going to share my screen. Hopefully everybody can see this. We're going to start over here. And this is our typical slide where we show our rolling average, our positivity rate. And I think your takeaway from this is that we're glad to see a downward trend. The other thing is that we've kept this positivity rate in a range that tells us that we've already suffered through some of the most recent spikes. So the other thing this graph tells us is that we continue to have robust testing, which is important. This slide, our hospitalizations are still favorable. That leaves us the capacity to be able to handle anyone that needs to be hospitalized for COVID-19, as well as any other medical needs. And this is what this is all about. We're protecting our hospital capacity. This slide, I think, is important today. This shows a case status from the 6 to 17 age range. I think this slide is a testament to how well our schools are performing while managing the COVID-19. So they've done a great job, and I think this slide tells that story. This next pie chart really is better reflected by this bar graph. As you can see, the majority of our cases are still in the age group of 18 to 24. This slide represents 2,200 cases over the last 14 days, and of those 2,200, about 65% fall into this age range of 18 to 24. Okay, let's see if I can come back live here. All right, hopefully I'm back there. All right. Okay, let me spend a couple of minutes visiting with you about tailgating. So tailgating activity around the game went very well this weekend. It was limited. I think some people were reluctant to get out, but those that were out did it very responsibly. We're grateful for that. I believe on the 26th that it can continue to be conducted responsibly. I think we'll see more tailgating activity on the 26th of the Texas game. As a reminder, you'll need to register your tailgate on our Lubbock Safe site. That's mylubbock.us/Lubbock Safe. Other gatherings, our fire marshal's office and our police department worked in concert with Texas Tech Fire Marshal's office, their PD, as well as TEBC. We continue to check on restaurants and bars, as well as after-hours checks. We've been fortunate that we have great lines of communications between all of these departments, as well as Texas Tech. I think we're all committed to operate our restaurants and any other gatherings in a very safe manner. Again, I mentioned our communication lines with Texas Tech. Any incident that we have that's involving Texas Tech students is submitted to the university for review and potential action. And I think that's a good segue into my next topic, which is house parties and party houses. So we continue to have issues with house parties and these rental facilities that are rented for parties. There is a way to conduct these parties safely. I think it's important that if you plan on having a party like this, that you plan to do it safely, because I think the alternative would be very unfavorable. Again, any of these parties that we intercept that aren't following the rules will be submitted to Texas Tech for review and potential action. Finally, I want to comment on masks. Masks are required anytime you cannot maintain safe social distancing, the famous 6-foot rule. Just because you're outdoors doesn't give you a waiver from wearing a mask. And so even if you're at an outdoor activity, you might be at an outdoor concert or a party, if you're talking to somebody or around people within 6 feet, please wear your mask. We know that that's the way that we can keep ourselves and each other safe. With that, that concludes my report, and I'll turn this back over to Lacey.
Thank you, Councilman. Okay, we're going to open it for media questions, and today's media order is Latino Lubbock, El Editor, The Avalanche Journal, Fox 34, KMAC, KLBK, The Daily Toreador, and Texas Tech Public Media. So let's get things started with Christy Martinez Garcia with Latino Lubbock.
Good morning, everybody. Thank you for your time. You know, we're about to hit the 10,000 mark, as Catherine mentioned, and I don't think any of us thought that we'd ever see this. We're also seeing a number of businesses that have closed, and then we're also seeing football. Everything's being affected, we know that, but this weekend, I went to a retail outlet because I'm listening to you, Steve, about supporting local business. No mask wearing, no social distancing, no kind of cleaning agents at all. who do we need to call? Remind us, because I feel like, and how are we addressing that? Because I know now, the bars are doing what they're supposed to, restaurants are doing what they're supposed to, but now we have a whole nother segment that's not quite following the protocol. So how should that be handled?
Well, I would call the non-emergency line to LPD, 775-2865. And we'll go out there and take a look at it. We've got our fire marshal's office will go out there, our environmental services, PD supporting that, and we'll go out and visit with them and share the rules. Most of our businesses are doing a good job, and I know there's some that maybe don't understand, or maybe they choose not to, but if you identify one of those businesses, please share it with us and we'll come out and visit with those businesses.
Awesome. And the next question, Dr. Cook, I know that children in the school districts don't have to wear masks unless they're in 4th grade and up, but I'm hearing from some teachers that they feel that the small children, like the kindergartners and through, should all be wearing masks. Also, one of the teachers expressed concern with the cleaning agent. It's a purple spray that they've been given that is highly toxic. How should we address something like that? Because I think this was given to them by their school district.
Thanks, Christy. I don't know what individual schools are using as far as disinfecting agents. Certainly, I would think that if a school district was buying that particular item, they would verify to make sure that it's safe to use in those environments. And so that ought to be addressed back to the school district and ask of those individuals if it truly is safe. Now, as far as children wearing masks, I have a number of patients and a number of friends that I know that their children, as young as age 2 and 3, or 3 and 4 and up, do very well with masks. It's the ability that for the child to be able to remove the mask in case they get sick or something like that at their stomach. And so that requires a little bit more supervision from a diligent parent, but children can wear masks. Now, the governor, I think, says ages 10 and up. And so I'd have to verify that number again, but children are quite capable of wearing masks as long as they have appropriate supervision.
So wouldn't you say that it would be okay for them to be wearing them in schools, even in, the younger ages, because that's a lot of the teachers feel like they're the ones that are kind of carrying.
Sure, and I think it's up to each individual school district to set that below the governor's standards, and so, or ages below the governor's standards. So
thank you all. Have a great weekend.
Thank you.
Thank you, Christy. Now we go to Olga Aguero with El Editor.
Good morning and feliz 16 de septiembre to everyone. There's a lot of good information being put out there. And now I understand, Catherine, as for the concern that there were some people wanting they were like lost on the data, but now we understand by what your improvements will be. And hopefully everyone will start benefiting from that, right? Would you say?
You're muted, Catherine.
I'm muted. I'm really excited about getting the new system online. It's been a lot of, behind the scenes work. It's going to make things, the workflows much better for staff when we're contact tracing, much better when someone calls at the health department. We'll be able to identify cases and who you're working with. So I think it's going to be better for the community all around.
Good. The next one is short, but of concern to the people. We're all in this together. We should reach out, like the doctor said, and check your neighbor and check your friends and your family by all means. But with that being taken into consideration, there are people out there that are worried and concerned about the numbers in general, but more concerned of the Texas Tech numbers. And what's it going to take to keep them contained and making sure that they're, I know they don't want to feel like that, but sometimes you need to. And I just wondered if that's what would be What's it going to take to be more concerned and put more attention toward the tech numbers or the general numbers?
You want me to? I'll take that one first. Maybe Ron, you can follow up. You know, Texas Tech has done a great job. They have a plan on how to tackle this. They've secured other lodging for when they need to spread students out, and so I think we maintain what we know works, and trust in the administration at Texas Tech. They've taken this very seriously and pushed through.
Olga, I don't have anything to add other than to verify and reiterate. I know that Texas Tech and the other colleges and universities in town are doing their very best to try to communicate and continue to make our college age population to be considerate and be professional and abide by those rules as best as possible.
Okay, gracias.
De nada.
Thank you, Olga. Now we have Matt Dotre with the Avalanche Journal.
Good morning, everyone. Dr. Cook, I wanted to ask you about the flu. You've mentioned the flu, I think, now for the past month. Is there serious concern that our hospitals don't have the capacity for peak flu season as well as COVID?
Well, it's all about capacity regardless of what the infection is. And so that's what we worry about. We could sort of put it in terms of a twindemic where we have both flu and COVID positive patients hitting our hospitals at the same time. Fortunately, flu, although a very serious illness, is not as serious, doesn't have the mortality and the what we call morbidity that the illness, that's a word we use for overall illness. Mortality is death, morbidity is the illness. Both of those hitting at the same time and then hitting our hospitals. So we always keep an eye on our hospital numbers, our ICU capabilities, and we all will use the same mitigation plans when that were to occur. If we start reaching capacity, both hospitals here in town have significant capacity to expand if necessary. We don't want to get there. Go get your flu shot.
For sure, absolutely. Can you talk a bit more about ICU capacity? There were some rumors floating around earlier this week that one of the hospitals was getting close to reaching their ICU capacity. I don't know if that's true or not.
Well, no, I get a data report from one of the hospitals, and they said they might be close, but that what they're defining as close there is really their baseline. That's with all things being normal, that would be their baseline, close to capacity. They have room and plans to expand those services if necessary. So we right now we have plenty of room. That doesn't give anybody the right to go out and be irresponsible.
Mm-hmm. That's it for me. Thank you, everyone.
Thanks, Matt.
Thank you, Matt. Now we have Brady King with Fox 34.
Thanks, Lacey. Good morning, everyone. For Catherine Wells, can you explain how the new system the health department is using, or reiterate how it will help with contact tracing and what changes the public will be able to see exactly?
I think from the public standpoint, I think it's going to be us getting data in faster into the system. When COVID first started, literally all of the reports were coming in via fax and had to be hand entered, which can create errors in itself. Now we're going to be able to receive multiple data feeds from our hospitals and from our laboratories. That's going to allow us to get that information in there quicker, to be able to deduplicate. If someone got a lab test twice in one day, we'll be able to see that very quickly. It's also going to have a more robust case management system where we can better have places to put notes to allow us to track individuals, and when they get recovered, we're able to send out some of that information electronically.
Okay, awesome. Thank you. And for Councilman Massengale, you mentioned tailgating went well this weekend, and there will likely be a lot more people in town for the Texas game. Do you think this weekend was a good test run for that? And how much do you think that weekend is going to help businesses and all of that?
Well, Brady, this past weekend was a good test run. I think people were feeling out the process, and I think some were reluctant to come out, but I think the Texas game will bring a much more activity. I can tell you as a small business owner that we're looking forward to that activity. This past week's activity the first home game was not what we had normally would experience.
All right, thank you. That's all I have.
Thank you, Brady. And now we go to Matthew Stell with KMAC. Matt, are you there? Okay, we'll go to Terry Furman with KLBK and come back to Matt in just a second.
Good morning, everybody. Couple of questions here. I want to go ahead and ask this, even though the mayor's not here. So Mr. Massengale, I would like for you to answer this. The city puts out these reminders on the daily COVID press release, reminding citizens, you talked about it, about the executive order prohibiting gatherings of 10 or more people in the city limits unless approved by the mayor. Now, how many of those requests have we seen and approved?
Again, a reminder, that's outdoor events over 10, and I do not have that in front of me right now, but a lot. And we go through them every day and review them. I review them myself as well as our business development director before the mayor approves it. So we're approving several events every day. You know, and I think one thing to note that's been on our radar this week is we're starting to see Halloween related events come through for approval.
Okay. A follow-up to that question, can you confirm that some of these things have been denied, or is every request for a gathering been approved for outdoor?
We have not denied any requests, but we have worked with them to improve their plan.
Okay. Very good. Thank you.
Mm-hmm.
Thank you, Terry. Now we'll go back to Matt Stell with KMAC.
All right, Lacey, thank you so much. Sorry about that. Two quick questions. My first one is for Catherine Wells. Catherine, we've had 8 deaths in the past 4 days. Can you kind of give us a little information about what were the age range of those deaths? And is this something that I imagine the health department is really concerned with?
Yeah, we definitely watch the deaths, and we check hospital records, every day to make sure we get those counted accurately. It was I don't have all of the information directly in front of me, but we had deaths in the 50 to 60 year range this week, along with older. We don't provide additional information beyond whether or not it's community exposure and an age range, just because we don't want to give any confidential information out to the public.
Gotcha. Okay, thanks so much. Next question really can be for anybody. We've heard Lieutenant Governor Dan Patrick saying that we should expect some sort of announcement from Governor Abbott about possibly going to the next phase of reopening and maybe moving our restaurants to 75% capacity. Are Lubbock restaurants ready for that, or is it something that they're still going to have to work on?
I'll take that. We have a lot of restaurants that have done a really good job. And so if that's the governor's decision, and I don't know that we've been telegraphed anything to that regard, but if that's their decision, I think the majority of Lubbock restaurants are ready for that.
All righty. Thank you.
Thank you, Matt. Now we go to the Daily Toreador with Amanda Hampton.
Hi, everyone. So some tech students have been saying that they're not seeing responses to their incident reports about large house gatherings. So should they be reporting these directly to the city or the university first in order to see a timely response?
They should be reporting to the city if they're off campus. I can't speak to the response, but if there was something specific, we could look into it.
So report to the city first?
Yes.
Thank you.
Okay, now we have Casey Ellingson with Texas Tech Public Media.
Hi, I'm curious, this question is for Catherine Wells. Now that we're about a week and a half away from Labor Day, have you seen any trends in your contact tracing? How did we do over Labor Day?
I haven't seen any positives directly associated with Labor Day large events. We have seen positives associated with, activities that were going on in backyards and houses. We expected that. I was hoping that we wouldn't see as many cases, but they are out there because of those events.
Okay, thank you. And then my next question, so a lot of videos of large gatherings have surfaced on social media from like college parties and stuff. So I'm curious if you guys think that the messaging to that age demographic has been effective and if it needs to be tweaked or changed.
I'll take that. I think we've tried to communicate as clearly as we know to communicate with that age group. I think Texas Tech has gone above and beyond to do the same thing. Some refuse to listen, and I think you still have that factor of that age group thinks they're bulletproof. I remember when I was that age, and so I think we just have to continue to reinforce the message and help them understand that there are consequences on these parties if they don't handle them safely and responsibly.
Mm-hmm. Awesome. Thank you, guys.
Mm-hmm.
Okay, this concludes our news conference. I think this is our shortest one ever. So thank you to our panelists and our interpreter, and thank you to the media for